we are seeking to have facility improvement fund ring-fenced in Tharaka Nithi County, kwamba ile pesa yote itakuwa kwa hospitali iingie kwa kiti ya hospitali na hizo pesa zitarudi hospitali. Kama kuna kuongeza pesa ya hospitali itaongeza kwa barabara, lakini pesa ya barabara inaweza ongeza ya hospitali. That way we will be able to make sure that we have more money to employ more doctors and also other cadres. We have two issues that we have looked at, or what really was our idea of interest. Kwanza kabisa tulikuwa tunataka kuona zile equipment ziko hapa ambaye zinasaidia wananchi. Sana sana kuna equipment zile za tunaita mess equipments, zile tulipatiwa in partnership with the national government. CS alikuwa na interest kuona kama zinafanya kazi, atatuambia kama vile ameona. Lakini kulingana vile ameona madam ni kwamba we don't have all the equipment here, kwa sababu as much as we have the x-ray, digital x-ray machine that are working, we have good theater machines. Tukihitaji picha ambayo inataka scanning kama CT scan, mpaka tuende mpaka Chuka ama tuende pali kama Meru.
We have had a lot of issues around this managed equipment services. And when I'm speaking to the media, I don't like calling it mess, because that connotation has gone very badly and many people think it's a very bad thing. It's a managed equipment system. And I have been able to see that it is supporting this hospital. I think we've been to the x-ray, we've seen the equipment there. We have been to theater, we have also seen the equipment there. And your people have confirmed to me that those equipment are in working condition.
Iko madaktari wengi sana ambao wako nje hawana kazi, lakini hapa hospitali kuna upungufu. Ni kumaanisha iko shida kidogo because they're out there but we can't be able to afford them. Na the situation is so dire. Mpaka doctors are feeling frustrated and some of them are even committing suicide. Very young doctors, we're losing very young people. Na kama counties lazima tutafute namna tukijadiliana na Ministry of Health vile tunaweza kuhakikisha kwamba we'll absorb more doctors in our hospitals to give this service.
It is a serious issue. We are taking it very seriously. We have seen that there is a deficiency, like the whole of this county. I think I was being told in the morning that we need to have about 50 doctors. Yet we only have 6 and working, and 14 are on study leave. So we need to have honest conversations, and here I want to speak to our doctors, our professionals through their professional bodies, that let us sit down and have a conversation regarding how we manage health workers. It is a high time. I already spoke to my Director General that we do an inventory of healthcare workers so that we get to know who is where, who is on study leave, and therefore how do we fill in the gap to ensure that patients are taken care of.
We are going back to the ministry to work on that report and see how we assist you to meet the requirements. But happy also that the places that we have visited, your X-ray department, we have visited your theaters, and we have noted the management equipment services that you have. I have taken note of those that are up and running, and I would like to say then that is the way to go. Unfortunately, we have one that is not working, and therefore for me as a minister is to put the vendor of that machine on notice, because these machines are on placement. You cannot have a machine here for people to be knowing that there is a CT scan, yet they cannot get the scans done. So whoever the vendor is, please know your notice from me. If your contract comes to an end, you'll have trouble explaining why we need to renew it, because you have to make it work for us to be able to renew your contract. So whoever you are, please come to Chuka Hospital, find out what needs to be done. And in future, we want vendors who are responsive. We cannot have a machine down for 2-3 months or weeks, because there are people who need services.
But it was checked in January.
No, the next was supposed to be on January. It was done on that.
Oh, in August.
Yes.
So the next was in January.
Yes, the first was.
They didn't come.
Not come for the service. Yes.
Is
Tunaona, yes.
Unaona? Yeah, because the sticker says they ought to have come in. Are the APS or separate?
Separate.
A separate contract with the Chuka?
No, with the Ministry of Health.
Maliziwa. So she was going to it's like here. Okay. Sawa sawa. Nilikuwa nafikia tujaonwa. Umeonwa. Sawa sawa. Yes.
We are both inside and outside.
Hello. Do you want to give some feedback? Like you want to say something? Yes. Nyinyi ni staff hapa, nyinyi ni wagonjwa.
You know what?